Hello, everyone. My name is Pharmacist Michael, and today I am going to talk about medication adherence. And I'm going to give you some tips on how to take your medications properly. You know, a lot of us are on medications for various different illnesses, but some of us don't know even what they're for. Some of us don't know what they interact with. Some of us don't have a current list of what we're taking. And I'm just going to give you some really good tips of things you should know about your medications. So first, be sure you understand your medications. What are they for? What are they doing for you? Do you really need your medication? These are all important things to keep in mind. You know, some of us start taking medications and 5 years later, we're still taking them. We might not need them in 5 years. So always know what your medications are for. Know the side effects. Know what time you're supposed to take them. Know what happens if you miss a dose. And if you don't know these things, it's easy to find out. You can either leave me a message or you can call your doctor or pharmacist. So that's number one, understand your medications. Number two, be sure you follow the prescribed dosing schedules. Just because one doesn't work quite good enough doesn't mean you should take two. Just because 2 is not good enough doesn't mean 3 is going to be better. Remember that. You always want to stick with your prescribed dosages. And there's a couple of reasons for that. If you're taking a controlled substance and you take them too fast, your doctor is going to know or think that you're abusing them, and they're going to cut you off. Or they're going to put you on a more strict schedule. So it's very important that you stick to the schedule that you are given. Number 3, if you have a hard time remembering to take your medications, utilize a medication organizers. And these come in a lot of different types, guys. You can get the little plastic things. I know you've seen them that say Sunday, Monday, Tuesday, Wednesday, Thursday, Friday. You know, that's probably the most economical thing. You can use your phone. There's apps on your phone that will remind you when to take medications. And they even make machines now that you can have filled that will actually dispense your medications at certain times of the day. So I've seen these. When I was working in the psych hospital, we had some patients that just couldn't remember to take their medications. And we were able, in some cases, to get these machines in, have a nurse or a caregiver fill them up. We never did it in the hospital because of liability reasons, but you can actually get these, and I'm sure you can find them on Amazon. They're definitely available. Number 4, one of the most important things I can tell you is don't skip doses. If you're on an antibiotic and you're supposed to take a 10-day course and you feel a whole lot better after 5 days, don't stop taking it because you feel better. And the reason for this is what causes antimicrobial resistance. What ends up happening is not all those little bugs die, and the ones that survive start duplicating. And that makes them, because they're not completely killed by the medication, the ones that survive are resistant to that medication, which means we have to use a different, stronger medication. And if you do the same thing with that, it's likely that the same thing will happen. So be very careful about skipping doses. If you're on oral contraceptives and you skip a dose, you can become pregnant. If you don't use a different form of birth control, if you skip antidepressants, depending on which one it is, If it's something with a long half-life like Prozac, it's not as big of a deal. But if it's something with a short half-life, you can start withdrawing. And that's true of benzodiazepines. It's true of barbiturates. It's true of a lot of different things. So if you do skip a dose, know what to do. In some cases, you take the next one as soon as you remember. In other cases, you just wait until the next dose is due. It depends on the medication. And again, if you don't know, ask your healthcare professional what to do if you skip a dose. This is very important because we all forget at times, right? Or we end up going someplace and we don't have our meds with us. Number 5, refill your prescriptions on time. This goes along with the last thing. Don't skip doses. If you don't have your medications, you can't take them. So be sure you get your meds refilled on time. The other thing that it does, if you don't, is it tells your pharmacist and your doctor that you're non-compliant. And depending on the doctor, some of them will have a talk with you. Some of them might decide to change you to something else, but if you're not taking your meds, they can't work. So it's kind of like buying a book and not reading it. You can have it on the shelf, but if you don't read it, it doesn't really do you any good. Your medications only work if you actually take them. I know that sounds super simple and obvious to you guys, but it's true. And you'd be surprised how many people just don't take their medications. Number 6, one of the most important things I would say is communicate with your healthcare team. I spelled team wrong. Too many E's. Oh, well, not going to fix it now. So communicate with your healthcare team. I can't tell you how many times I've consulted with people on the phone and even in practice at the hospital, and they'll tell me, oh, I stopped taking that 6 months ago. And I'll say, really, did you tell your doctor? No, I didn't figure he'd care. Or no, I didn't want him to know because I thought maybe he would think less of me. Or they have reasons why they don't want to tell their doctor they stopped their meds. That happens a lot. Another thing that'll happen is they'll say, well, I'm supposed to take 2 at night, but I've only been taking 1. That's fine, but make sure you communicate that with your physician, because what you're taking only 1 of when you're supposed to take 2 could be something that's super important, right? It's something that your doctor needs to know. And the other thing I will tell you is if you're on a beta blocker like metoprolol or something like that, let's say, and you're supposed to take 100 milligrams at night and you're only taking 50 and you get hospitalized and you're unconscious, they're going to think that you're still taking 100. They don't know you're only taking 50, right? So they're going to base their treatment changes on what they think you're taking, and you may not be able to give them a good idea of what you're taking if you're unconscious, or you're just unable to remember maybe. Who knows? You could have been in a car accident. You might be unconscious. You might just not be able to remember. But we'll get to the med list later. But be sure you communicate with your healthcare team. And when you spell team, just put 1 E in there. Number 7, educate yourself. Know what your drugs are, like I said, number 1. But educate yourself about what the drug does, how it works, why you're taking it. Educate yourself about whatever your disease state is. Be careful when you go online. Oh, we've got lots of comments. Let me look at the comments, guys. I can't see them all. Hi, Janet. Hi, Twinkie. How are you two doing? Thank you for coming. I really do appreciate it. Got to go back to my, now I lost my, oh, there we go. Okay, I got back. I can't see the banners at the same time I see your comments on this. So, and if there's a way, I haven't figured out how to do it yet. But anyway, educate yourself. Be very careful when you go on Google to educate yourself. Do not go on there looking for information and assume that if you see something that says this is a deadly symptom, that you have the deadly symptom. Don't do that. Don't do that. Use Google only for information in a positive way. The doctor's probably going to tell you, maybe even too often, if you have something that can end your life. Don't look for it. Don't do that. And be sure when you're on Google and you're reading things that you're looking at pages that are prestigious, okay? Johns Hopkins University is one I look at. Okay, if I find something that says, Dr. Stanley or something, and I've never heard of the guy, and I start reading it and there's misspellings like I just had on here and stuff like that, I'm not going to put a lot of stake in what I read there. But if I read something from Johns Hopkins and it's got actual references built into whatever it is, I'm much more likely to believe it. So be careful where you get your information. Or comments. Sometimes, hi, Kat. Sometimes I fall asleep before taking my blood pressure medication. If I normally take it at 8, can I take it later, like 11? Absolutely, you can. You can. The secret is with blood pressure medication that you don't want to take too close together. And if you have a blood pressure cuff or a machine, it's always good to check it every once in a while. If you were in the hospital, Janet, we would take your blood pressure every time right before we gave you a blood pressure pill to make sure that your blood pressure is not already too low. If you're diabetic and you're in the hospital, we would check your blood sugar before we gave you any anti-diabetic medication or insulin. We would want to know where you were at first, because the last thing we want to do is drop your blood pressure lower if it's already low, or drop your heart rate lower. So yes, you can take it at 11 if you normally take it at 8. That should be just fine. Okay, let's go back to where we were. Number 8, be aware of potential interactions. When people think of interactions, they think of drug interactions. If I'm taking an anticoagulant, I can't take vitamin K. That's a classic example, because vitamin K stops warfarin from working, right? If we want to reverse warfarin, that's one thing we do, is we give somebody vitamin K. So people think of interactions as 2 different drugs. If you don't know what drug your drug interacts with, you don't need to know every drug interaction. You just need to make sure that you're not taking something that interacts with it from a different doctor. That's why it's important to use the same pharmacist. And that's also why it's important to get a good one. Because if you end up in a place that fills 600 prescriptions a day and they're short-staffed and they're just zipping trying to get the stuff out the door, they might miss stuff that's super important. But there's other kinds of interactions besides drug interactions. There's drug supplement interactions. For one, St. John's wort is a big one with antidepressants. You have to be careful with it. Turmeric and anticoagulants can cause a problem. But there's also drug disease interactions. And a good example of this is bupropion cannot be taken with somebody who has a seizure disorder. It's contraindicated. Why? Because bupropion, or Wellbutrin, decreases the seizure threshold. Haloperidol cannot be given to somebody with Parkinson's disease. You say, oh, Haldol, that's for crazy people. Haldol is used for delirium in the hospital every day. And a lot of doctors just don't know that it's contraindicated in people with Parkinson's. So as a pharmacist, every time I see an order for Haldol, I automatically check to see what their diagnoses are. If I see Parkinson's on there, I'm going to call the doctor and I'm going to say, please change this to Zyprexa. Haloperidol is contraindicated. But what if I'm not there? If you have Parkinson's disease, you or your family member needs to know what drugs you can't take, what makes Parkinson's worse. And the answer is almost all antipsychotics can make the movement disorder worse. So that's something that's very important, guys. Interactions are more than just drug. There's drug-food interactions. So you've read on your, probably some of you have pills that say don't take grapefruit juice when you take this medication. And the reason for that is because grapefruit juice can affect the metabolism of some drugs. Some things you can't take with, like Maalox. You got to be careful with dairy products with some things. And some of them are antibiotics. So if it says don't take with milk or dairy products, you don't want to do it because it can stop absorption. It can wreak havoc with how your body metabolizes it. And all of those things can happen. So always read the labels also on your little pill bottles because they should have them. Okay, number 9. This was probably one of the most important things, if not the most important thing on this list. As somebody who has worked in a hospital for years and years and years and years, I'm going to tell you that you need to have an updated medication list of every single thing you take and when you take it. And if you're a woman, you should carry it in your purse. And if you're a guy, you should have it in your wallet or somewhere. So if something happens to you, the EMTs or the doctors or the nurses or whoever's treating you can find it, because we might not even know who you are. We need to know what your medications are. This is something that we do in the hospital every day. We have technicians to do what we call medication reconciliation. They go and they talk to the patient and they find out how they take their meds and all of that. But if you're unconscious or you're unable to give information, having that list can save your life. So I'm going to tell you that it may not seem important to you right now if you're healthy, but if you're taking medications, if you have allergies, any of those types of things, you should have that somewhere, not just in your chart, but somewhere on your body if possible. Super important. In the institution, they tried to give me a med that interacted with my Ticocin. I swear they knew nothing. And this is another thing, Kat, that I will tell you is, depending on what type of hospital you're in, they might not know. They might not even know what Ticocin is or what it does. And they might not even have a pharmacist on staff. And if they do, they might not know either. So it's super important that you stay informed about, you need to know what your meds are. You need to know how they work. You need to know what they're for. The other thing I'm going to tell you, and I didn't have this on my list. In fact, number 9 is my last thing here, but I do want you guys to ask me questions. So that's why I'm here. And I'm going to open up the comments so I can see them all a little bit better here. Every time you get a prescription filled, I want you to be sure you do one thing, and this is very, very important. Somewhere on that label, it's going to tell you the description of the tablet that you have or the capsule that you have in that bottle. Make sure that what your label says matches what's in the bottle. Because I'm a pharmacist, and I got a medication filled that was supposed to be for sleep, and it was for blood pressure. And I ended up almost falling down because my blood pressure dropped so low. And why did that happen? It happened because I knew the tablet was different, but I just figured it's a different brand. I didn't even bother to look at what it said on the label. And it was the wrong drug. So that's why the labels tell you what the pill or capsule or whatever is in that bottle looks like. If it says it's red and it's supposed to have 56 on it and it's orange and it doesn't have anything on it, you need to call the pharmacist and tell them, why is this different? And another thing that you can do, and anybody can do this too, is if you have a tablet and you go into Google and you type white round tablet A67, because that's what it says on it, it's going to tell you what it is, and it's probably going to show you a picture of it. So it's your responsibility to protect yourself. I mean, it's their responsibility to fill the prescriptions correctly, but if they make a mistake, sure, you can sue them if you die, but you're dead, right? What if you hurt somebody else because you're in a car driving and something happens to you because you're on the wrong drug? Be sure to protect yourself. Pill Finder. Yes, Pill Finder will do it too. Do you guys have any questions for me? I'm sure you probably do. There's quite a few people in here. There was 6 in here at one point, which is pretty good. I know I haven't been live in a very long time. And the reason for that is I'm working on a new product line with Janet. So it should be coming out. I'm hoping, who knows when for sure. I mean, this is the type of thing that takes a lot longer than you think it will. It's just, getting everything ready. And we're going to do some different things that I think you're going to like. It's going to be super exciting for me and you too, probably. But I've been working on that, and I've really been concentrating more on my business and on YouTube, trying to get. I've done some recent videos on menopause. I've done one on fentanyl. I've got one coming out tomorrow on the new birth control pill that's going to be over the counter. I think that's a very interesting change. I've been really spending time trying to make myself a better person. I finally quit my second job, so I have more time to dedicate to everything else that I have to do in my life. And I'm excited about it. I mean, I think that it's going to lead to very good things in the future. And that's my plan. Another thing I want to tell you is when I told you one of my tips for you today was to utilize your healthcare team, and I can be your healthcare team. You guys, anybody out there that's watching this can utilize me. You can send me a message and ask me any question you want to ask me, and I will be happy to help you. I help people every day. I will go over your med list with you. I can help you with some of your symptoms. I am not a doctor, so I can't diagnose you, but I can take a look at your meds and tell you if there's something that I would change, or if there's just something that you should ask your doctor possibly to change. I do this all the time. It's something I do for free. I do it because I like to do it, and I will continue to do it as long as I have the bandwidth to keep up with it. Now, if I start getting thousands of people wanting me to do it, then of course that's going to be very difficult for me to do. But right now, I have been able to answer pretty much everybody's email, I think, and I've talked to several people on the phone. I've went over med lists, and I've tried to help people the best I could. So that's what I do. If you have any questions for me, put them in the comments. If you want more live streams like this, also leave them in the comment. It will also help me if you tell me what you want me to talk about, because I am planning going forward to do at least one live stream per week. I would really prefer to get people and interview them because that's what I like doing the best. But if I run out of people to interview, then I will do streams just like this one. So I hope you guys enjoyed this, and thanks for coming in, and I will be seeing you very soon. Be sure you check out my videos. My name is Pharmacist Michael. Be happy and be healthy.